Good evening. I'm Scott Wapner. On day 85 of the coronavirus crisis, President Trump speaking tonight about reopening the American economy as Wall Street waits for a big move from Washington.
Stocks are falling as the Senate fails yet again to advance its virus aid bill.
Waiting on Washington.
Why are the American people still waiting? It's a good question to ask.
As the markets and America teeter on the brink, Senate leaders battle it out over the stimulus.
We're very close to reaching a deal. We all know time is of the essence.
How long can the markets hold out? How long can businesses and workers hang on without a deal? This CNBC Special Report, Markets in Turmoil, starts right now. Here's Scott Wapner.
And it is good to have you with us yet again tonight. Another sell-off on Wall Street today after the Senate failed for a second time to push through a massive stimulus bill. The Fed also announced today a barrage of new asset buying programs. When the bell rang, the Dow was down 582 points. The S&P 500 down about 3%. The Nasdaq closed slightly lower. During his news conference tonight, President Trump talked about the distribution of new medicine and reopening the American economy.
At my direction, the federal government is working to help obtain large quantities of chloroquine. And you can look from any standpoint tomorrow in New York. We think tomorrow pretty early, the hydroxychloroquine and the Z-Pak, I think, is a combination, probably is looking very, very good, and it's going to be distributed. We have 10,000 units going, and it'll be distributed tomorrow. It'll be available, and is now. They already have it. They're going to distribute it tomorrow morning to a lot of people in New York City. Our country wasn't built to be shut down. This is not a country that was built for this. It was not built to be shut down.
So is the president right? Will America be ready to get back to work soon? With us now is the former FDA Commissioner and a CNBC contributor, Dr. Scott Gottlieb. Once again, Doctor, it's good to talk to you tonight.
Thanks a lot.
You heard the president tonight. This country is not built to be shut down. Is the president in danger of moving too fast?
Well, I don't know what the White House is thinking in terms of the mitigation tactics, the sort of population-based mitigation tactics that we now have in place, where people are being asked to shelter in places where this has become epidemic. Schools are closed, businesses are closed. But this epidemic is going to need to run its course at this point. I mean, New York is having epidemic levels of spread. That's going to continue for some weeks before we see the peak in this. That peak is likely to happen sometime in April, mid-April to late April, probably more likely late April or early May. And remember, this right now is epidemic in New York City. We likely have other large cities that are similarly seeded that are a couple of weeks behind New York. So we're going to see other cities probably have the same level of spread or something close to it as New York. Hopefully not as bad because they implemented some mitigation steps earlier. But certain cities like New Orleans were late to this and seem to have spread right now. And so you have to be very worried that they're going to also have large outbreaks.
Dr. Gottlieb, Dr. Birx tonight in that news conference said 28% of tests in New York City are positive versus 8% elsewhere. It's to the point you're making about the hotspot that New York City is. When is an appropriate time to go back to work? How many weeks are we talking about?
Yeah, well, we're going to have to see this epidemic peak and in those cases come down. And so it's maybe another 6 to 7 weeks till a peak and in 6 or 7 weeks until it comes down. I think it's going to be very hard to fully take our foot off the brake until you start to see some significant declines in the number of new cases on a daily basis. And there's going to be continued increases in new cases for some time now. We're just at the beginning of this. We're about 2 weeks into this right now. And so what you do towards the end of the epidemic spread is you start to substitute in case-based interventions, trying to identify cases, isolate individual people, as opposed to mitigation tactics where you're isolating an entire population. So you can slowly take your foot off the brake as you introduce those case-based interventions, but you need to have the tools in place to do that, and that requires very massive screening, and we don't have that in place yet. Hopefully by April, May, we'll have that in place and we'll start to be able to make this substitution very slowly like China did. But you can't take your foot off the brake too quickly or the epidemic can flare again.
Do you feel as though the president and the medical experts, doctor, are on the same page tonight?
Well, I don't know. I mean, I don't know the discussions that are going on in the White House right now. I think that there is a desire among some to try to look for ways that we could isolate regions, isolate states, and intervene more aggressively in the places where transmission is continuous and epidemic, and maybe less so in places where it isn't. The problem for the United States right now, dissimilar from China, is that we're likely to have epidemic spread in multiple regions. We have multiple hotspots taking shape. China was able to largely isolate this to the Hubei province. They had outbreaks in other cities, but it really became only epidemic in the Hubei province. And so they were able also move in massive resources into that province and into Wuhan. They literally brought thousands of doctors from other parts of the country into Wuhan. We're probably not going to be able to do that because while New York is the first to fall, we're likely to see epidemic spread in other cities. Seattle looks very hot, San Francisco, Chicago. You have to worry about any city that has a mass transit system because this seems to be spreading through contaminated surfaces. And so mass transit can become a vehicle by which this is spreading. So Chicago, New Orleans, parts of Florida. Florida was late to implement mitigation tactics statewide. And so is Louisiana. So you have to worry about those cities, that they're heavily seeded at this point. We're going to need to keep a very close eye on them.
Let me be more plain, Doctor, if I could. If the president asked you tonight if people should go back to work in the middle of April, your answer would be what?
No, not in the places where there is sustained community transmission, which is a lot of parts of the country right now, and certainly not in New York. But any place that you see sustained community transmission, we need to keep in place some mitigation tactics, these population-based tactics, until we can break off those chains of transmission.
The other idea to consider is it wouldn't necessarily be up to the president, would it? I could see a scenario in which governors and mayors perhaps would have a very different perspective on what the president would want people to do. How would we manage that?
Well, look, a lot of this has been really led by the governors and the mayors. The governors have been making individual decisions, and the federal government and the White House has deferred to governors on those decisions. So while the White House can issue recommendations on what they think ought to be done at a local level, it's really up to local officials to implement these public health measures. The federal government has some authority to both supersede local officials on implementing stronger measures as well as lifting certain measures. But by and large, this is up to governors. And we've seen a lot of governors act very strongly and early. I mean, San Francisco took some early steps, and we're seeing the growth in new cases in San Francisco be slower than other parts of the country right now, I think demonstrating the benefits of acting early and aggressively. The stronger we are early in this, the less severe this is going to be, and the more ability we're going to have to keep the number of cases at any one time below the point at which the healthcare system gets exhausted and we start to see people have bad outcomes.
Are we still on pace to flatten the curve? Or are we getting away from that, and dangerously so?
It's hard to know. I mean, we don't have enough epidemiological data now, enough data points, enough days into this to really know where we are. It looks like we're still on a steep part of the curve, at least as it pertains to the tri-state area around New York, where the case counts are building rather quickly and are likely to continue to build. Remember, the cases that we're seeing presenting right now to hospitals, and that's really where people are being tested. They're not being tested in the community in New York. Those cases are people who might have gotten infected a week or two ago. The time to hospitalization is 9 to 12 days. So anyone being hospitalized now for COVID-19 in the tri-state area probably got infected a week ago. And if you argue that the doubling rate is 4 to 5 days, which is probably what it is right now, because we haven't, or at least what it was 2 weeks ago before we got in place these mitigation tactics, you can imagine that there are a lot of cases right now in New York, and many of those cases are going to present to the hospital now a week or two from now. So this still needs to build some before we start to see it leveling off.
I want to discuss, lastly, if I may, Doctor, the notion of a drug that the president keeps talking about. Maybe you call it a cocktail, if you would, a hydroxychloroquine and the so-called Z-Pack. The president keeps saying there's a good chance that it could have a great impact. Can you separate fact from fiction for us tonight on whether this drug should be used right now to treat this virus or not?
Well, look, it is being used. This drug was being used off-label by doctors around the country prior to it sort of becoming the subject of a lot of discussion at a national level. The data, there's both in vitro data, meaning in test tubes, as well as clinical data coming out of China and also a study out of France. It's very preliminary. The study that a lot of people are pointing to is a study involving 20 patients, 6 of whom received this combination of azithromycin and hydroxychloroquine. And hydroxychloroquine seems to be more promising than chloroquine alone. And in those 6 patients, after a short period of time, after about a week, they had negative nasopharyngeal swabs, meaning when you swab their nose, you couldn't detect virus. But it's very unclear whether they cleared the virus and actually had an improved clinical outcome, or whether they just stopped shedding the virus in those swabs in their nose. There is precedent for and a reason why you might have a drug that acts locally on tissue and might make it so that a nasal swab would be negative, but isn't acting systemically, meaning isn't actually clearing the virus from the body. So it's very preliminary, and it's a very small number of patients. Certainly something that we should follow up on, and there are going to be proper clinical trials underway.
Appreciate your time, as always, tonight. Doctor, thank you.
Thanks a lot.
That's Dr. Scott Gottlieb joining us once again tonight. Markets moving while watching the Senate, hoping for a stimulus plan to pass. Nothing yet. Kayla Tausche is live in Washington for us again tonight with the very latest. Hi, Kayla.
Hi, Scott. Negotiations continue on Capitol Hill, though no breakthroughs took place in meetings with Senate leadership this afternoon, according to a senior White House official. Now some top Senate Republicans are suggesting they restart talks tomorrow, starting fresh after that stimulus package failed to secure enough votes to move forward for a second time. Senate Majority Leader Mitch McConnell earlier today saying that because of the chamber's rules, it could be even further delayed without unanimous support.
By refusal to allow us to take this first step, which would have still given them plenty of time to negotiate, we have put the Senate in the following position. If any one of the 100 of us choose to object, we can't deal with this until Friday or Saturday at the earliest.
The package originally put forth by McConnell and Republicans is now nearing $2 trillion after multiple rounds of negotiations. House Democrats have separately floated a 1,400-page plan that raises the dollar figure of many of those components and adds a bunch of new provisions as well as a host of new regulations. But today, House Speaker Nancy Pelosi suggested that she would be open to taking up the Senate's package for a vote in the House, so long as a bunch of those Democratic asks made it in. Scott?
Kayla, we appreciate it. Kayla Tausche reporting for us again tonight. Billionaire hedge fund manager David Tepper joining me earlier today on the Halftime Report, discussing what he's doing with his money right now.
You have to be very selective right here because there's some industries that will be changed and some industries will be more affected over a medium or longer term, because I do believe we'll be in some sort of social distancing. Stocks in general, if you look at past periods, I mean, we could be here. Here it could be 10% lower. If you're not worried about being 10% or, lower or 15% lower, it may be a time to buy a little. And that means buy a little. I don't want to go full-fledged 120% right now, but it could be interesting at these levels. I mean, there are some companies that will come out, and I'm sure in a year or two, in 2 years, are going to be higher, no doubt. There are some other companies that may not be around. I would say, I'm nibbling there, and a little bit of healthcare today, hospitals and such, but mostly there I'm nibbling, I would say, in that tech sort of stuff. I'm also buying some corporate loans, some sort of junk loans, and today, we do a lot of bonds, so we're doing some of that today, some bank debt. We're doing, we are nibbling, no question about it. I mean, we're along a few different asset classes. Things look really interesting for the long term. Show me the ventilators rolling off the factory floor. Okay, that should be it. Hopefully that can happen in a week or two. Show me them. Take your cameras and show me them. The President of the United States should go there to see the ventilators and see them coming off I'd love to see him do that. I'd love to have him have that moment. Okay, I really would. Okay, I really would like him to have that moment. Get it done. Use your powers. Get it done so we can get out of this thing, and it will get done. Let's get serious now, not, whatever it takes. This is a whatever it takes moment to move forward. I'm confident. Listen, this is the United States of America. We can get this done. And it's one step, and they should have a phase, and they should tell people, listen, once we're out of this first phase, whether it's 3 weeks, 1 month, 2 weeks, whatever it is, it doesn't make any sense, these peaks of months from the previous data. I don't understand it. You can't go into lockdown mode forever, but you have to plan this out.
That was David Tepper for us earlier today. Let's give you your first look at futures right now. The Dow would open higher right now by some 475 points, nearly 500. Still waiting on stimulus, though, and a lot can happen as there are many hours before the opening bell tomorrow morning, of course. Jim Paulsen is Chief Investment Strategist with the Leuthold Group. He is with us live by phone. Jim, you heard David Tepper. He said he's nibbling. He said buy a little. Could be interesting at these levels. What do you think?
I kind of agree with him, Scott. I think that, this stock market through last Friday, in its first 22 days of this bear market, fell by 32%. And then the previous 13 bear markets that we've had, the worst one, 22 days in, fell a little over 7%. On average, the other 13 fell 5%. So this market, this bear, in the first 22 days has fallen almost 6.5 times more than any other bear market in post-war history. At a minimum, I think that's got to say there's a lot of damage already incorporated into stock prices today. We're going to get bad news, but a lot of it, I think, is in there. I think the reason it came down so fast, Scott, is because there was no debate about a recession. We just proclaimed one by announcing we're going to shut down everything. And so the stock market didn't wait, like it usually does, to debate whether it's just a slowdown or recession. It just instantly went to the recession case. So I think a lot of this is in the market, and with values where they're at and panic at very high levels, I think it's okay to be nibbling away on bad days. I agree with David. I wouldn't put all my chips in. I'd let this thing settle down, but I do think if you have a horizon 12 to 24 months, you're going to be happy if you add a little risk here right now.
What happens on the vote, assuming it passes one day this week? We sure hope.
I think to me, I don't think it's the be-all, whether we pass this or not. I think we know we're going to get a stimulus package at some point, whether it's tomorrow, whether it's Saturday, we're going to get one. And that's not going to solve everything right away either, Scott. It's more of a bridge to hang in there. What we're going to have is a curve bend at some point. I think we'll probably get one, but until that happens, fiscal stimulus isn't going to be the savior. Fiscal stimulus will help a lot when the curve bends, because if you have a bridge under companies, then after the curve bends,
right,
that could build a lot of confidence for buying down the road.
We understand. Jim, thank you for your time this evening. That's Jim Paulsen from the Leuthold Group joining us this evening. Up next, a doctor on the front lines fighting the virus in a busy emergency room. This CNBC Special Report, Markets in Turmoil, is just getting started.
What happened in Singapore that allowed officials there to get the upper hand on the coronavirus so quickly? Plus, life between a hospital and a church in one of the world's hardest hit areas so far.
The bell of the church were ringing, and actually it's the sound of the dad.
Before the break, pictures from around the world.
It's good to have you back with us tonight. Italy is one of the virus's biggest victims so far. Tonight we hear from one quarantined Milan resident who hears only sirens and church bells. In her own words tonight.
2 weeks ago, I didn't know anyone that was sick. A week ago, I knew people sick. Now I know people that died. It's going to start the fifth week of quarantine. I have two daughters. One, she's 6 years old, and the other one, she's 2. I live near a hospital, and I have a church behind me. And I hear all the time ambulances. And I realized yesterday that the bell of the church were ringing. And I was like, that's different sound. And actually it's the sound of the dad. And it's happening all the time. And I realized that that's another sign of the situation that we are living in. But we're doing the right thing now. So we'll see the result of this right behaviors and measures. I know scientists say, okay, it's going to happen in 2 days, it's going to happen next week, but it's not happening. And now I have the feeling that it's out of control.
That was Milan resident Greta Privitera in her own words tonight. Well, many see Singapore's response to the virus as a model for the rest of the world. Tonight, CNBC's Meg Terrell has Dr. Dale Fisher, professor of infectious diseases at the National University in Singapore. Meg?
Scott, thank you so much. And Dr. Fisher, we're really glad to have you here. You know, it was just today that the World Health Organization's Dr. Mike Ryan was saying countries like Singapore and South Korea haven't had to use the same measures like closing schools, restricting movements, the same draconian measures we're having to take in the U.S. and elsewhere. Help us understand, what has Singapore done that has enabled it to get a hold of the virus without having to take those actions?
Thanks, Meg. From the outset, we've believed that this can be contained. I've often heard of experts in the US, for example, say that containment is futile, and it's just wrong. This disease can be contained, and it has to be contained. And we don't do anything particularly special. We just do all the typical outbreak response interventions thoroughly.
Well, we know you are also part of the joint mission to China with the World Health Organization, so you've observed there as well as working in Singapore. As you're watching the United States and other countries not work on containment as much, what are the key things you think this country should be doing?
I think the lesson from China is that no matter how bad it gets, it can still be contained. Wuhan, even when it was at 40, 50,000 patients, it ended up with more. Realized that this could be contained, and they contained it. Now, they had to do a lockdown, of course, because it was out of control, as it is in other parts of Europe and so on. But they didn't stop. They didn't stop wanting to contain it. They isolated their cases. They had massive testing, and they did contact tracing. They had 9,000 people doing contact tracing to find the cases so that they could be tested, isolated if they were positive, quarantined if they were negative, and they brought it down. They've got 0 cases now. They're reopening, and they're ready to go around again, because now they're prepared. Obviously, they weren't prepared at the beginning because they were ground zero, but they've ramped up and they're ready.
Well, when you observe the testing situation in the United States, do you think it's even possible for this country to do those kinds of tracing and isolation when we don't even know everybody who has the virus here?
Again, China didn't know everyone that had the virus. When Korea was having 900 cases a day, they didn't have they didn't know who everyone was. It's just, you just have to get in and do it. And you know, I think most of the world is quite shocked at what's happening in America, because you're America. If it's quite hard to understand why, with American power and strength and ingenuity, it's just like you're going to let the tidal wave hit you, and the devastation that goes with it. It's really quite surprising to the outside.
If you have one takeaway message for folks watching in the U.S. right now, just go a little bit deeper into what containment means. What is the one thing this country needs to be changing about its response?
I think the first thing is the attitude. The attitude can't be one of mitigation. This is not a word. This is a flu word. We're not using that word here. We're talking about surge, and we're talking about building capacity for if we do get excess cases beyond our capacities, and Singapore likewise is ready for that. But No, it's about containing. And containing means early ascertainment of your cases, broad testing and isolation of cases.
All right, Dr. Fisher, thank you so much for joining us. We look forward to keeping the conversation up with you. Have a great day. Scott, back over to you.
Yeah. Meg, thank you very much. That's Meg Terrell, Dr. Dale Fisher with us tonight. Here's where we stand this evening on the virus right now. Boeing planning a 2-week production shutdown at its factories in the Seattle area. The State Department says more than 13,000 U.S. citizens abroad are asking for help to get home. And British Prime Minister Boris Johnson has issued a stay-at-home order for the United Kingdom. Rhode Island postponed its presidential primary election to June 2nd with a recommendation to use mail-in ballots, just a sign of the rising fear level in that state. With us there is Dr. Megan Ramey. She's an emergency room physician and associate professor at Brown University on the front lines in the fight against this virus. Doctor, we're grateful for all that you are doing and for your time this evening. Can you tell us how things are going at your hospital?
So let me be clear. My hospital has been tremendously proactive. We've been conserving personal protective equipment, or things like masks, gowns, face shields, for weeks here, reusing them the way that the Centers for Disease Control is now recommending. But we're doing that because we're gearing up for the fact that we are not getting large shipments in, and that we can foresee a time when it would be possible to run out. Unfortunately, that reuse is something that is being seen across the country, and it is not what is recommended in normal times. Usually most of this equipment is disposable. As we see rising number of patients with symptoms consistent with COVID-19, it's putting my colleagues, not just locally, but across the country, on edge. The previous segment talked about the coming tsunami, and depending on which emergency department you're in the United States, you feel like you're waiting for the wave to hit, or you feel like it's already coming into the shore. And here in Rhode Island, we are certainly starting to feel that rising wave.
What do you need most tonight, doctor? And if you could speak directly to the president and his task force, what would you say?
So the thing that we need most tonight is increased production of personal protective equipment, things like masks, gloves, N95 respirators, hand sanitizer, equipment like ventilators. And then we need the government to be in charge of figuring out who needs it and getting it to the right health system in the right state at the right time. That is absolutely what we need. We're not asking for the government to serve as shipping clerks, as President Trump said a couple days ago, but we are looking for the government to step up and to help coordinate, to support all of us on the front lines.
Can you tell us about the website that you started? It's getusppe.org.
Yeah, so we as physicians and nurses, in conjunction with a large software development community, have created this grassroots effort to try to get protective equipment for ourselves, because we are not seeing it come from up above, because our state governments and healthcare systems are so limited in terms of what they can get. We've set up this website, getusppe.org, which is basically matching people who can make donations with healthcare systems or individual healthcare workers who need it. You know, again, my hospital is well prepared, but individual clinics, smaller hospital systems are running out or have already run out. There's even a line on the CDC website saying that healthcare workers should use bandanas when everything else runs out. Let me be clear, that is not effective at protecting us from getting sick. And if we get sick, then we can't help patients. So getusppe.org is to help link folks together and use that American ingenuity while we hopefully see the government start to step up.
We'll certainly do our best in spreading that word with all of you. Can you give us, lastly, doctor, an idea of what exactly you're seeing in patients, the kind of problems that you're seeing, and also the age breakdown? There's so much concern about who is most at risk amid numbers that suggest a lot of younger people are starting to show up in emergency rooms.
So in general, with the COVID-19, and I'm going to make the caveat here that, of course, we can't test most people. So in Rhode Island, like across the country, we have very limited testing. But in general, what we're all seeing is increased number of people with body aches, difficulty breathing, really bad coughs. And then kind of as it gets worse, they start having more respiratory difficulty. and some people have diarrhea and other symptoms as well. We are seeing a wide distribution across the country. There were recent statistics that came out that showed that actually that 20 to 50 age group may be just as at risk of critical illness as the older age group. We're watching the statistics from Italy and France and starting to track them here in the United States at all. But I would say don't feel like you're protected just because you are a millennial or Gen X. The data from the ground is suggesting that we are equally at risk.
Doctor, thank you for your time.
Thank you.
That's Dr. Megan Ramey, again, on the front lines for us tonight up in Rhode Island. Straight ahead, what investors need to watch tomorrow after stocks rose from their depths today. More ahead on this CNBC Special Report, Markets in Turmoil.
Next tonight, the mayor of one of America's biggest cities on the massive challenges he's facing. And one of this country's most famous chefs with an emotional lesson on managing a staff in the restaurant business in the midst of this crisis. This CNBC Special Report, Markets in Turmoil, is coming right back.
Stocks remain under pressure in a volatile session.
Stocks jump and fall back.
The Senate's serious bipartisan process turned into this left-wing episode of supermarket sweep.
Maybe the majority leader thinks it's unfair to ask protections for workers and labor to companies that are getting hundreds of billions of dollars. We think it's very fair.
All while waiting on Washington for a deal, as Senate leaders fight it out. This CNBC Special Report, Markets in Turmoil, continues. Once again, here's Scott Wapner.
No deal equals another volatile day on Wall Street. Let's give you a look right now at where the futures are shaping up as we wait for a vote in Washington. The Dow futures would open higher right now by some 400 points. So green arrows across the board, at least at this very early hour. Today, stocks sold off after the Senate failed for a second time to push through a massive stimulus bill. The Dow falling 582 points. The S&P 500 was off about 3%. But the Nasdaq was only off a fraction. Energy, financials, and real estate were today's biggest drags. For more on the markets, let's bring in Brian Belski. He is Chief Investment Strategist with BMO Capital Markets. Brian, it's good to see you this evening. Thank you for being with us.
Thanks, Scott.
Give our nervous investors watching tonight where you think we're going from here.
Well, I think you have to kind of look at scenarios, quite frankly. Number one, you have to look at what's happening with COVID. And until we start to see a second derivative, less negative stance with respect to news, we can't say the downside is done yet. So given that fact and given what we are in terms of timing, we could see another 10 to 20% downside. But that's over the next few months, Scott. I think what you need to hear is that we are resolute in our conviction with respect to how strong the U.S. stock market is. Remember, too, that there is no magic bullet. We're looking at the government. We're looking at monetary policy. We're looking at potential bailouts. We're looking at support levels. They're not working. You know what works? Good old-fashioned stocks. And when the market begins to rally, we think we're going to see an epic move to the upside, something that we've never seen before, just like we've never seen the last 22 days of downside. So we anticipate a 40 to 50% rally off the low to get us right back close to where we were.
Wow, that's an aggressive call. Do we start rallying if Congress passes this stimulus plan?
I'm a little worried about that, Scott, quite frankly, because it's not that magic bullet, right? I think so much we want to look back at history to say, yeah, the government came in, or again, the support level or monetary policy. Again, I think this is all about COVID-19 headlines. And when we start to see a dramatic improvement, less negative, and then move into that, then we keep talking about the curve. The curve will improve. And we think it's going to be specifically very positive for U.S. stocks.
Brian, we appreciate your time as always. We'll talk to you again soon. That's Brian Belski joining us this evening. There is much more ahead on this CNBC Special Report, Markets in Turmoil.
Tonight, one major American with a lot of trouble already begins facing something we've never seen before. The mayor of Houston is with us live next. Plus, one famous chef's emotional message in this time of crisis. How he's managing people, food, and his business. Before the break, images from around the country on day 85 of the crisis.
Welcome back. Texas now has more than 700 confirmed coronavirus cases. We're talking now with the mayor of Houston tonight, Sylvester Turner, as the city works to open more test centers and some cities in the Lone Star State prepare to shelter in place. Mayor, good evening. Thank you for being here this evening.
Thank you for having me.
Can you please tell us what's happening on the ground there? Your citizens are being asked to bear a lot between the fallout in crude oil and now COVID-19.
True. We're doing more testing. That'll give us a better assessment of what's happening out here in terms of community spread. We're asking all of the people in our city and the surrounding regions and in other large cities and counties as well to engage in social distancing, to work, essential businesses only, work remotely from home where possible. A lot of our businesses and others have either shut down or they're working a very restricted schedule. Of course, our social arts events, many of our clubs, restaurants, and all of them have shut down or just doing curb service. So we recognize that we have to do everything that we can to blunt the progression of this virus so that it doesn't overwhelm our medical health system.
Can you give us an idea where testing is today versus last week and how your hospitals are coping tonight?
Well, we started up on Friday in terms of our public health testing. We've been approved for 4 sites here in the Houston area, 2 in the city, 2 in the county. We have opened up an additional 2. I think all 4 will be up in the next day or 2. In addition, there's private testing that's taking place. So every day, hundreds of people are being tested, and we're getting, of course, more cases that are being tested positively. But it's still relatively low in the region. In Houston, for example, as of today, there are like 24 cases that have come positively. But we're just starting to ramp up on the testing in the region, in the Houston region. It's about 150. And then, of course, as you said, in the state of Texas, it's over 700. And so we're trying to do everything we can to get to try to slow the progression, to blunt the curve. We recognize that for every case that comes back positively, there are probably 9 to 10 others that are out there that we haven't detected.
Mm-hmm. Mr. Mayor, it's clear from listening to the president that he wants the country to reopen for business as soon as possible. Curious as to how you're thinking about that question in your own city tonight.
Well, this is the energy capital of the world. We have the largest medical center in the world, the #1 port in terms of foreign tonnage in the United States, and I can go on and on. But we're having to balance our health care concerns with our economic interests. And that's why even in the city of Houston, for example, in the surrounding areas, we don't necessarily talk about sheltering in place. I think it's better that we say stay home, work safe. Because we recognize that in order to blunt the progression, we're going to have to engage in social distancing and do things differently for the next several weeks, if not several months. At the same time, we know that if we work collectively, we work together, the quicker we can get on top of this and the quicker we can get back to business as usual in the city of Houston and the surrounding region. But when that will take place, we don't know. What we do know, if we don't work now to blunt the progression, it's going to drag on far longer than any of us would like, and it's going to create, it's going to turn and have a significant economic impact on the city of Houston and other places as well.
Mr. Mayor, we wish you and the good folks in Houston well tonight. Thank you for being here.
Thank you for having me.
That's Mayor Sylvester Turner of Houston tonight. Next, an individual business owner on the massive new wave of challenges he is facing tonight. Plus, famous chef Eric Ripert on managing a staff and a restaurant amid the shutdown. We're back. The Princeton Record Exchange celebrated its 40th anniversary on Friday, but owner John Lambert just laid off nearly everyone on his staff. Here is another individual business owner tonight in their own words.
So at this point, I've laid off just about everybody. Obviously, they're scared. I don't blame them. I'm scared too. I can't collect unemployment as a business owner. It's one thing when you close for, say, a bad snowstorm. When it's open-ended like this, it's very unsettling. In particular, rent. Yeah, we've got 4,300 square feet in downtown Princeton, and I won't give the numbers, but most people would be staggered by that amount. But an open-ended environment, when bills keep coming, I don't know how long we can last. If you truly want to help small businesses or small business owners and then trickle down to the employees, I'm begging you for some sort of rent relief. That to me is the #1 issue here. It's all well and good to say, give people across the country $1,000, $2,000. That doesn't help. That's not going to keep my business going. You have to help me with rent. You have to help me with my fixed costs if you want a business like mine to succeed.
And that was small business owner John Lambert in his own words for us tonight. We've been following the restaurant industry, as you know, and Eric Ripert is the chef and co-owner of the critically acclaimed Le Bernardin. He joins us via Skype this evening. Eric, it's good to see you. I wish it were under different circumstances, but thank you for being here.
Thank you very much. Me too. Wish better circumstances, yes.
How are you coping with your restaurant being closed, and what are you doing with the staff? What can you tell us?
So we closed a week ago, and we thought we would be closed for 2 weeks. Then we realized that it would be a much longer period of time, and therefore we had to lay off the staff. And that the restaurant is closed, obviously, and we are waiting now for the government to come and to help us, because the restaurant industry is not being saved right now in the packages that the government is offering.
How much help do you think you need?
Well, we need help with the taxes, sales taxes, payroll taxes. They have to give us a longer period of time to pay that. They have to give us some loans so we can have some cash flow when it's time to reopen. If not, it's going to be nearly impossible to bring back the businesses the way they were. Restaurants have a lot of labor. Le Bernardin had 170 employees for one standalone restaurant. It's a lot.
Do you worry at all about your ability to reopen?
Of course, I worry about it. But for now, what is more important is the health and the safety of the clients and the employees as well, of course, the purveyors, everyone who interacts with the restaurant. But yes, I'm very concerned about the reopening of the place.
Do you think there are a number of restaurants in New York City, not only at the very high end where you reside, but of all price levels, that some may never open again?
I am sure that some operator will not be able to reopen because restaurants have a very slim margins. A lot of them do not have that much cash flow, and those restaurants will not be able to reopen.
Are you already thinking about what life on the other side, so to speak, of all this will look like, even when you do open your restaurant? The fact that there may be some level of social distancing that will still have to take place in restaurants. Tables won't be allowed to be as close together as they are now, and you may not even be able to have as many patrons in the dining room as you otherwise might.
It's very possible, yes. We will adjust the team depending on how many covers we have to do per day. If it's 50 covers a night and the tables have to be spaced, we will need very few employees back at the restaurant. And then I guess it will be progressive and we will rehire the staff as needed.
And I don't assume you're doing takeout or anything like that at this point. Your restaurant can't handle such a thing as that.
No, our restaurant is not geared for that. And Midtown right now, I don't know if you have been to Midtown in New York, but it's basically dead in the streets. It's no one working. Everybody's at their house working from the home office.
Eric, we wish you well, and your employees the same.
Thank you very much. On their behalf, thank you.
All right. That is Eric Ripert, again from Le Bernardin in New York City. On day 85 of the coronavirus pandemic, here are the latest headlines this evening. President Trump says he hopes to reopen the economy for business in weeks and not months. Talks ongoing tonight as lawmakers try to reach a deal on a massive stimulus deal. The Dow and the S&P both fell 3%. Futures right now are up across the board, though we are with our eyes peeled on Washington, D.C. Go to CNBC.com all night for up-to-the-minute information on the markets and the virus. We're back tomorrow at 5 a.m. I will see you back here tomorrow night. Be safe. Be well.